we have one chance to get the spine right. This orthodontic series is dedicated to the people that I've seen on the table that I just looked at them in the office when they came in, and they're this, and they're this, and they're this, and they're talking, and I'm looking at them like, okay, they have braces for sure, and they have a concussion history. So this series is dedicated to them and to the kids that hopefully can process through a more aware, holistic approach to what you're doing with your teeth and your jaw and your airway. So in the grand scheme of things, we're not going to do a one-size-fits-all. There is no one-size-fits-all. Diet, alignment, fascia, craniosacral, somatoemotional, myofunctional therapy exercises. This straw, actually, surprisingly, lymphatic drainage of the face and ears, facial trigger point release, all of these have a place in this holistic approach regimen for airway, orthodontia, alignment, spinal cord, posture, concussions, growth spurts. It all has a place, which is why I fully was ready to completely mock this Remplenish Straw. I bought it because we're on this journey together with our daughter, who's 8, and she's seeing an airway orthodontist. And so this Remplenish Straw was advertised on my feed, and it was saying that it was fixing all the airway and mouth breathing went away and all of this, which I didn't believe. But I figured I'd take one for the team and order it anyways. And I probably could benefit or should have benefited from a tongue tie here. My back part of my tongue does not go up to the back part of the roof of my mouth. And so what this straw is, which we were kind of mocking when we first got it in the house, that it's a backwash straw. But it gets you to put that whole part of the straw in your mouth to use the back part where your hard palate meets your soft palate, which I have people doing tongue exercises and like a yawning throat stretch, like trying to widen your tonsils. That's a standard that I do to try to get this part, people to move in better with the upper part of their neck. But so I used this straw, laughed at it a bit, and then used it again. And then that night I had a really sharp pain right in my, what I'm going to call my trigeminal neural ganglion. So it wasn't my TMJ, it was deeper than that I got this really sharp pain in the left side of the trigeminal nerve. So between what you're getting from using the back part of your tongue, you're actually stimulating that soft palate meets the hard palate, the tonsils, and that really deep tissue of the muscles, that the cranial nerves that innervate this whole area of your face. The trigeminal nerve has different research on it with trauma response, not just you hurt your face, so now you have trigeminal neuralgia, something more like you have anxiety or you had a trauma, which then stimulates, gets this hyperfacilitation of the trigeminal nerve, which messes with and regulates your heart rate along with the vagal fibers. So this straw, I've decided, I've given it to clients of mine that have trigeminal facial pain, neuralgia, really tight vocal cords, really stapled here. I feel like the straw actually has a really powerful application for your airway orthodontist journey. Do I think it's an end-all be-all? No. We're using this straw. I have my daughter using this straw. I'm using it every day for a bit to see if it can change this ear jaw. So after a couple days of using it, when I was drinking out of it, I started to feel some crackling in through my eustachian tubes. So I feel like this straw also has applications for, facial development, motor and sensory to the face, people that have facial pain, kids with ear infections. Definitely it's stimulating very deep back in here to get like that massaging, what I call when I do body work. And it feels like you're shaking the rug. Like if you vacuum, there's vacuuming in your house, and then there's pulling back the rug and then seeing everything under there, or being in your closet and just like shaking your sweatshirt. And then it's sunny, so you see all the dust. So this is doing a temporal fascial release is the passive way to get to that fascial tissue. And then this kind of stuff is going to help your nervous system move back into using your whole potential. So things I would recommend on your journey is this expensive Remplenish Straw. I have a different video that goes through doing facial trigger points. Right, so there's facial trigger point right here that you can hold for a few breaths. There's going up under your eye socket, and there's one right about here. And if you press on it while also simultaneously trying to relax your neck and jaw, you can feel its implications to the back of the skull. And then just also taking this type of a finger shape and going down the masseter muscle through there. And then gargling, right? So the dental hygiene of flossing, the Sonicare, taking your Sonicare toothbrush and aiming it toward the teeth roots. This isn't orthodontia per se. Kids shouldn't have a ton of latent viruses and bacteria down at the teeth roots, but if you aim your Sonicare toothbrush down through the bottom of the roots, it can help that. Make the rug go like this. Dust out your sweatshirt. So Sonicare along through there. Self trigger point release. Get a gua sha, that tool that helps you take the lymph. The lymph is going to dump through here and down through the thoracic outlet under the collarbone. So routing all of that tissue this way and down is going to be helpful. Gua sha tool, just your, good as just your fingers, just getting in the shower and not like doing this with your fingers, but anchoring down and really getting the scalp to move, which is another thing. When my daughter gets out of the shower, I will take the towel on her and really, I'm not pulling her hair, but I'm trying to move her scalp just to kind of do this. Not hard. You're not looking to be so hard that the kid has to tighten against you, but just a little gentle. Get your scalp moving. Get your scalp moving. Get your collarbone open. Stretching this way. So the other thing that I found sort of accidentally when I bought an electric shaver is this Braun thing, this thing that obviously isn't going to help anyone's cellulite, but it's marketed for that. But like anything else, as soon as I get like a therapy gun, I'm putting it on my jaw and my neck. Vibration of this particular stupid cellulite tool works so well to just have it. I take it right along here. I put it over my lips. We have parasympathetic nerve fibers in the lips. So just get it in, obviously, same thing. Trying to not have teeth infections as I grow older. Your child, right, where we are talking about child and orthodontia, Margot likes this. I take it through her sinuses. Over toward the ears, around the back of the ears, down the neck, and then this way, and frontals. So calming those fibers of the face is also getting that pleasure feedback to the facial nerve, the trigeminal nerve, which does also feed back into safety. Safety, pleasure, and then tiny, tiny incremental maxilla, tiny, tiny fascial release. So also with viruses, when you move the facial bones, if your child has that history of a lot of ear infections, sinus infections, if you have that, moving the lymph, and then low glycemic, low inflammatory, high protein, electrolytes in the water, and you can add things like zinc and garlic just to help your body move through what's under here. If you're moving the mouth, you're moving infection. If you're stimulating the teeth roots, you're moving infection, inflammation. So give your body a break. Try to give it the tools it needs to give you your potential because it wants so hard to please you. Take the load down, get your sleep, get your sunshine, get your fat-soluble vitamins. Hop on, get your kid in to see a professional, get yourself some body work. Get yourself, your own nervous system healthy, get your child's nervous system healthy, get their cord, slack their cord the best you can to give them more options. If you're trying to fix your kid's posture, or if you want to prevent that crazy posture, the tech neck of all this screen time, address the dural membrane, address the posture, address the face, address the lymphatic drainage. If there's too much, latent inflammation and infection here, your body's just going to tighten around it. So it's a whole program. I recommend this weird razor thing, not just for the razor, but for this. I use it more for this, honestly. The Remplenish Straw, the myofunctional exercises for the tongue. I obviously think, like I said, I think I need a tongue tie release. Craniosacral therapy, myofascial release, airway-informed orthodontist. Use the tools. There's lots of tools. There's no one answer. You got the Remplenish Straw. You got the massager for the lymphatics, a gua sha, trigger points. Open the back of your throat. Move the tongue around the top teeth and really stretch out that tissue that when it's stuck, you don't get circulation, you don't get lymph flow, and you get feedback loops. If your throat is tight, because of mechanics or infection or scar tissue, tonsils out and whatever, you're going to tighten tissue. And tightened tissue sends a feedback loop into the spine that you're stressed, you're anxious, especially around things like the facial nerve, trigeminal nerve, vagus nerve, that have that modulating effect on being. Find yourself a local professional, find yourself a really good airway-informed orthodontist, address your kids along the way, focus on prevention. You can hop on my videos to learn how to do some basic fascial release. I'll take you as far as you want to go. You can join the Parent Bodywork Project. I've got moms in there, marketing people, restaurant owners, who else? Engineers, learning how to help their kids at home. My aim to prevent the stuff that I see in the adults for your kids, mom to mom.